Yeah. So, hello everyone, and everyone is planning to sit for the exams and wish you good luck. And Mayzar Ramadan's background of any has been for 3 years. I've done it here, and then I started the trainings, and then I've done different jobs. Uh, I'm now GBST 3. My CCT is due in October. And my journey started, to be honest, with Amro. It's not like in for the SCA. My journey started early from the AKT. I think Amro, we are the first group. We start with you, the AKT course, the free course, if you can remember.
I do remember,
And
yes. Yeah.
yes, yeah, we first groups, and we got like a very good like course materials from this, and which you help us to pass the AKT also, and then essay exams. So basically, there's a many courses on the shop, and you need to be careful to pick up the one is suitable for you. Uh, Most of my talk will be like towards the IMG and also British candidate. I need to make a balance between those. So there are some courses that is my just look to you down as IMG failures high, and even like now as IMG, we believe that is we're going to fail before even we try the exams. And I think this is the big things we have at the moment is the big issues. Now we all like subconsciously believe that is we're going to fail the exams. However, our chance is equal to any candidate, any British candidates will have equal opportunity to pass the exams. But this need to have first, you need to follow the right approach, right course. The timing is very important. So myself, my journey started early, and and I think the course will give you the idea about the exams. And Amro, I think they will do this, and he will help you to understand the structure of the exams, and then your task. You need to know your task. Those two things is very important for the exams. The rest of the course, and especially when I had the like the record course and then the materials, and I think if you stick to the materials, I went through it. Most of the cases, if it looks similar to what you will have on the materials, it's not far away. The same idea. Medicine is medicine. Whatever they cannot change it. They cannot bring something from the marsh. All from the books. So the case is asthma, uncontrolled diabetes. So the way that I'm just made these materials, I think he spent a lot of times, a lot of effort to make like these materials, which is up to point. And I follow these materials. I haven't studied any other courses and just focus on these. And the first thing I think you need also, before you start deciding to take the exams, you need to involve your education supervisor or clinical supervisor in these decisions. Because I've got many of my colleagues, like they finished just ST2 and they were in the hospital and they just took the exam the first few months. They never involved the education clinical supervisor. And I'm afraid just they failed the exam for a few times, like 3, 4 times. So involve your education supervisor just to double check you're on this right way to pass your exams. And this, I think, this involvement will be done not by just by asking your supervisor, but are you ready to take the exams? By doing a lot of COT, a lot of CBD, joining clinic is very important. Join clinics will give your supervisor where you stand. And when you will have this decision with your supervisor, ready for exams, start preparing by choosing the right course, choosing very important to have the right candidate, right colleagues who will give you genuine advice and feedback. he should be harsh on you. And I was lucky. I got my partner has been with me like from the ST2 when we've done the AKT, we've done SCA exam together. So, and just you need to practice with the right people, guys. And the other things also, when you start practicing, you need to have what we call a consultation modules in your mind. Just don't leave it to the chance. You have to practice in your modules. You have to master it. You have to like you got on the top of everything in the right times. And as IMG, we got a big troubles usually, and I think most of us we have, especially for for people who never had any experience in UK and they start the training straight away. And with the British candidate, they have advantage in this case because the communication skills. This is their culture. So for us, we need to adapt this culture. We need to adapt a lot of things with how the people talk here. And this because this will just try to put us similar or closer to the British candidate or the people who studies here. So interpersonal skill is very important, guys. Any course that can offer you a positive help regarding your to improve your interpersonal skills, take it. And I've seen Amro had many courses. I've seen it before. I think they are very valuable and very useful courses. There are no harm to try them. And at the end of the days, it's a simple exam, guys. I took this exam and I passed by the grace of God for the first times. And the funny things, the station that I failed on it, I failed on two stations. Those are the station I know them in and out. Because when you know the station in and out, you wouldn't be a doctor, you'd be a medical student. So you will just say what's inside your mind. So just be yourself, be a doctor, and follow your guts. And try to make the consultations patient centers. Put yourself, your feet in in the patient's shoes. This will make the journeys more smoother, and you explain to the examiner that is you sharing your thought and your plan with the patients. So don't hide your thought from the patient. Say, yeah, share this the thought. I think you got this. Let's ask you about the sign and symptom of cold equina, like nerve damage. Do you have this? Do you have this? So don't hide your thought, and this very important. And 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 I think by continuous practicing, this will just polish you and let you ready for the exams. And also start practicing on the whiteboard from earlier times. And even when you got the exams, you might not use it a lot, but it will be useful also because we write a lot of notes that is you might forget at that time, especially the stress around you. So what I think is I will go to summarize what it means through. Be yourself and try just to do what you used to do. Don't change your styles. Your style is perfect. Guys, we've done medical student, and I'm sure any doctors, he passed all the previous exam, he can pass any exams. And do the practice with the right colleagues, choose the right course, avoid the courses that is just put you downs and look you downs. IMG, they have a high rate failure, and this is I think it's not truth. Our number is a small number if related to the British candidate. If we there 100 doctors and 80 persons is British and 20 as IMG, we have 5 or 10 failed the exams. This doesn't mean we are fail. Just because my colleague that's what's not about the exams, they follow the wrong approach, wrong course. Uh, they not involve their education supervisor. My suggestions now I think you're on the right track because you're starting attending this course. which will help you a lot just to get you to the level to pass the exams. And I'm sure most of you will pass the exams at the end of the day, and we will see you in the better place soon. Just do your best, and if any questions, we're happy to answer. If any queries, any times, my number in the groups. I will stay in the group. I wouldn't leave the group, and uh, we're here to help as we are colleagues. Thank you very much, Dr. Am. If any question, I'm happy to answer.
Thank you, Dr. Ramadan, and congratulations for passing from the first time. Guys,
Yeah,
does
sure.
anyone have any questions? All right, so Dr. Vaidaya, Sarayu Vaidaya, you probably go first if you have any questions to ask.
Hi. Thank you so much, Dr. Ramadan. So this is so I just found out I failed the exam yesterday, and I'm quite devastated because I really didn't expect it. What tips do you have for sort of how to restart and sort of um get back into the whole practice for SCA and you know try again, sort of.
Yeah. Yeah, and I'm so sorry you didn't make it this times, and this sometimes is so distressing, and I think these are normal human feelings, like it can feel a little bit downs. However, there's a lot of room to improve, and we trust you because you are a doctor, and you've done the difficult exam than this one. This is small, just steps, and you're able to go through it. So I think the first steps, just try to reset yourself, like forget about everything, build and just polish what you have. I think already you have a good stuff, just need to be shine to show to the examiner, and practice with the genuine feedback. And I think Amro, they have a very good mocks. They give you a genuine feedback, and in this feedback is similar to one you will have it in the exams. Okay, and also very important, don't distract yourself by a lot of materials. Stick to one materials and follow it to avoid the confusions. And I think this, if you try to do those, and I think you'll be safe, and we hear a good news about you soon.
Thank you.
Guys, any more questions? All right, if no more questions,
Yeah. So I will leave you guys, and I wish you
thank
good
you.
luck.
All right,
And
we probably
it's,
will have Dr.
yeah,
Ayman. Yeah,
no
Dr.
worries.
Ayman, sorry. Yeah,
Yes,
Dr.
I,
Hi.
Ayman, go
yeah,
ahead.
Hi, thank you. Sorry. Congratulations, firstly, for passing the exam and becoming a GP. Congratulations.
yeah.
My
Thank you.
question really is roughly how long did it take for preparation with obviously help of Dr. Amar and everything to get ready for the exam? Um, what would you advise in terms of timings and everything?
To be honest, because I'm less than full times, and we start to prepare around 3 months. We start slowly during the weekend. Anytime we find ourselves free, we practice. However, we practice immensely in the last month. We almost took like most of our leave, and we have like we practice for almost 10 hours a day, 8 hours a day, going through the cases, doing essay revisions, give feedback. Especially, I think 3 weeks, we just doing this continuous to every days without any rest.
So, did you do the extended course or the crash course? Because I do have like 3 months before the exam, so I've opted for the extended course, but I feel
Yeah,
like I'm losing out on these live sessions or,
you, I think you don't need to worry about you losing the session because it's being recorded. For me, I had I think the one for 5 weeks or 6 weeks, and I used to listen to the videos while going to work, driving my car, going around, walking small walk, and listen just to the record. Even like my family here, they said you will have a car crash because you've been addicted to this Egyptian doctor. So, so, and yeah, so I think 3 months is more than enough. If you just spend times and just do it hardly, it's more than enough.
Perfect. Thank you so much.
Yeah,
Thank you.
you're welcome.
Can I ask a question?
Yes, please.
Congratulations, Mr. Ramadan, for
You're
passing
welcome.
the exam. Yeah. So you mentioned that you had a maximum leave before the exam, 3 weeks,
Yeah,
about 8 to 10 hours, continuous practice with your colleagues. But
yeah.
over CS and ES, usually they mention that we shouldn't have any long leave before the exam, but that is not very helpful. I don't know. What do you suggest? Uh,
So
long leave
yeah,
before the exam, not going to see real patients would be
yeah,
helpful?
yeah, yeah. So because I've tried the downside of when I said one of the way to improve your chance to pass the exams by doing the joint clinic with your supervisor. However, the real patients, they're not being like they never be similar to the patient will have it in the exams.
I agree
So
that.
yeah, and it's totally different. So for me, like which works very well. I have 3 weeks. Even my colleagues, uh, he never had any real patience until just finish the exams. For me, I have the 2 to 3 days. I just return and see my real patients, but they're no different. However, because these patients in the SCA been designed in the certain ways, which are totally different from the real patients. So I think you can take, they can say what would like to say. However, I found it useful just to spend sometimes doing the case by case and with the with the genuine feedback. And I think this will maximize your chance to pass the exam.
All right. Thank you.
You're welcome.
All right, guys. Any more questions before we close up with Dr. Ramadan?
Yes,
All right.
Dr. Ramadan,
Yeah,
congratulations on passing.
you're welcome.
Did you say 10 hours for 3 weeks? In the,
Yes.
oh my God.
Yeah. And to be honest, it looks a lot. However, if you done it with the right person or right people, you will enjoy it. It's very
Mm,
important to enjoy the journey. And because I found the essay preparations, to be honest, even will improve your practice in the real life. Trust me, I've just after finishing the exams, a lot of things I was struggling to do it, I become more comfortable to manage it.
mm.
This will
Okay.
impact you in the day-to-day basis.
Mhm.
Yeah,
Okay, thank you. I
no
appreciate
worries.